In the headlines, health care for female veterans. The Veterans Administration reports a 12% rise in the number of female patients since 2006 as more and more women join the services. This Veterans Day, we examine a new report finding women often have difficulty accessing proper health care services in a system that has traditionally catered to men.
I walked out of my office building one day, and there was a fence, and there was a woman standing behind it who had a scarf on. And immediately my mind thought, oh, it's a detainment camp, and there's an Iraqi woman in a detainment camp. And I thought, it only took a half a second. That's all it is. And you go, wait a second. I'm not in Iraq. That's not a detainment camp. That's just a woman with a scarf. So things like that, things you can't control.
Carolyn Schapper served as a human intelligence collector and interrogator in Iraq for a year. She's one of 300,000 Iraq and Afghanistan veterans suffering from post-traumatic stress disorder, or PTSD. Among women vets, PTSD, hypertension, and depression are the top mental health diagnoses. But since women can't technically serve in combat, Schapper says women often find it hard to prove and get coverage for mental health issues.
But most women, if they stay at base or they didn't write up their own reports or their commander simply didn't give it to them, have no way to prove that they were in combat. And the VA has to look at that. They have to determine, is this woman telling the truth? And does she deserve health care? Well, my opinion is that if a woman's willing to go into the VA, which is not easy because there's so many hurdles to get over, and is willing to open herself up like that, most likely she needs some sort of help.
For some women, PTSD can be triggered after sexual trauma. Nearly 1/3 of women soldiers report experiencing sexual harassment or other military sexual trauma while serving. This can make it all the more difficult to seek treatment in a majority male environment. Schapper describes going to the VA for care as both overwhelming and intimidating.
Generally, just to be less visible, I will try to dress down. I'll try to cover up that I'm a woman, and just so I can get through there with the least amount of comments. A lot of women, if they have experienced military sexual trauma, are hesitant to go get treatment. One, because the hospitals are generally overwhelmed with Vietnam veteran males, and they don't feel comfortable in those environments. And they don't know who their provider will be. It's very possible their provider will be a male, which is also another reason for discomfort.
A federal study found none of the VA facilities it visited fully complies with privacy standards for women. Only 14% of VA facilities provide women's health gender-specific care. Schapper hopes the new report by the advocacy organization Iraq and Afghanistan Veterans of America will shed light on what she calls the injustices women vets face after returning home.
For so long, our issues were pushed aside, because we're only 15% of the military force. So it makes sense to take care of the whole, take care of the greater numbers, but they were letting us slide. And so this report brings out that all to issue. And I think it's wonderful timing, because we just got the advanced appropriations for the VA health centers, and hopefully the VA will be able to plan better and provide better services for the women.